welcome to our webinar, which is the fifth in the National Genomics Lunch and Learn series, which is exploring the basics of genomics and looking at where it shows up in our everyday practice and where it might be making a difference in the future. So today we're going to be exploring genomics in newborn screening and specifically focusing on a new research study called the Generation Study, which is currently live, and we're recruiting at selected sites in maternity units across England. Now, before we start, we just have a little bit of housekeeping. So we are recording this session and it will be uploaded to our website and our YouTube channel, and the link to the recording will be shared with everyone who registered. So please do share the link with your colleagues. We're aware that not everyone can attend who might want to, so it will be available to anyone who wants to watch it afterwards. So because we are recording it, if you could keep your microphone muted and your camera off during the presentations, then that would be appreciated. And if you've got any questions, pop them in the chat and we will look at those at the end. There will be an opportunity to ask questions at the end as well. So just to introduce the presenters today. First of all, myself, I'm Karen Creed. I'm lead midwife for genomics in Central and South Genomic Medicine Service Alliance, or GMSA for short. We've also got Yvonne Mwala, who is Regional Results Coordinator. Hi, Yvonne, at North Thames GMSA. We've got Dominic Stoddart, who is also Regional Results Coordinator for the Generation Study at North Thames GMSA, and also lead nurse for genomics in the South East. And we've got Kate Marsh, who is lead health visitor for genomics at North Thames. So, like I said, today is the fifth webinar in our series, and it builds on some of the topics that we've already discussed in past webinars. And I've just put the list of those previous webinars on this screen, and there is a link there that takes you to the recordings if you want to go and have a look at those. So today we're going to be exploring the Generation Study, which is considering how whole genome sequencing can be used as a screening test for newborns. And if you're not sure about whole genome sequencing, then it might be a good idea to go and revisit that first webinar where we talk about genomics and genetics in more detail, and we talk about whole genome sequencing. Today, we're also going to have a look at the aims and objectives of the Generation Study, how the study works in practice, and how we manage the results. So this, of course, builds on that second webinar, which was talking about genomic testing and looking at consent, ethics, and research. So again, that might be another one to go and revisit if you haven't seen that already. And then at the end today, we've got a case study which looks at how the Generation Study might influence practice in the future. In fact, hopefully, I had got a little poll that I was going to launch, but unfortunately I can't do that because I'm now sharing my screen. So we'll do that at the end and see if that works. I was just trying to find out how much people knew about the Generation Study, but we'll do that later. So just to set the scene, I just want to give you a little bit of an introduction, and what you'll see on this slide is a copy of Fit for the Future, and this is the government's new 10-year health plan. And if you've read it, you'll know that genomics features heavily throughout the report, and indeed it's named as one of 5 transformative technologies which going forward will help personalised care and improve outcomes. Now, the report also specifically commits to supporting the Generation Study, and I quote, it states, "We will support the Generation Study as it sequences the genomes of 100,000 newborn babies. This study will inform our longer-term ambition to make genomic sequencing at birth universal." Now, you'll see there that I've highlighted the word inform, and I think that's really important because the Generation Study is research, and the findings from the study will help inform future policy. We're not at the stage yet where newborn screening is going to be introduced into mainstream care. There's certainly a lot to do before we consider that, and that's why this study is so crucial. So let's find out more about the study, and I'm going to hand over to Yvonne and Dominic, who are going to tell you all about it.
Thanks, Karen. So I'll just introduce the Generation Study. It is a long-term research study, and it aims to understand how we can improve and diagnose, treat genetic conditions, looking at DNA of newborn babies. And it involves collecting a sample of blood soon after birth to read the baby's genome. Next slide, please. So a little bit about the sponsor of the sponsor of the study. So it's I think somebody needs to mute.
Oh, sorry.
Thanks. So Genomics England are funded by the Department of Health and Social Care, and they're the sponsor and the coordinator of the study. Their two core functions are to support evaluation of genomics in healthcare and also to accelerate genomic research. Next slide, please. So the study is, as Karen said, is looking to sequence genomes of 100,000 newborns, and it's evaluating the utility and feasibility of screening newborn babies at a larger scale, and also understanding how babies' genomic data could be used for discovery research, focusing on developing new treatments and diagnostic for NHS patients. And it's also exploring the potential risks and benefits and broader implication of storing a baby's genome over their lifetime. Next slide, please. So currently, some of you may already know of the newborn screening program, which is part of the antenatal newborn screening tests, which screens for 9 conditions, and there's some evaluations also being done for other new conditions. Next slide, please. So the generation study is looking to add 200 plus more rare genetic conditions that usually appear in the first few years of life, can be improved if found early, and there's already treatment available through the NHS. Next slide, please. So the conditions that are being screened for on the generation study were picked because of 4 core principles, which are that the variant causes a condition, and there's a confirmatory test that's already available, and the condition is highly penetrate and significantly impacts quality of life, and early or pre-symptomatic intervention improves the outcome of the children, as well as that intervention is equitably accessible for everybody on the NHS. Next slide, please. The study also used an approach driven by core design, ethics, and engagement. So there was a lot of work that went on behind the scenes before the study was implemented, and it included all of the stakeholders from NHS England, the National Screening Committee, Department of Health, also going through ethics to make sure that the conditions and education, training, evaluation was available. Also some public dialogue on condition selection, discovery research, and also there were some user research which was done with 145 parents and a range of healthcare professionals. Next slide, please. The study aims to be inclusive, so recruiting from everybody so that it's representative of our population. So there's just you can see all the different groups that we aim to be able to recruit to the study. Next slide, please. And this just outlines how the study works. So parents are recruited during pregnancy. A sample is collected ideally from cord blood shortly after birth and sent off to Genomics England, where the genome is sequenced and results are received within a few months. Sample and data is stored for future research, and there'll be ongoing contact about the study with the parents, and they aim to reconsent the children who participate in the study at the age of 16, just to make sure that they still want to stay in the study. Next slide, please. And this is just an outline of the experience of the participant. So the areas that are highlighted in blue is what happens within the NHS setting, and in black, that's the participant's journey. And then in pink, it's where Genomics England and partners are involved. So it just goes through the recruitment, consent, and sample collection. There's a little bit of a wait while the genome is being sequenced and analyzed. And for the results, so myself and Dominic from North Thames, we receive the results that we then coordinate to make sure that the babies are followed up within the NHS and they have their confirmatory testing. And if the condition is confirmed, that they receive the right treatment. Next slide, please. So, and this is just showing where we are. So the study has been embedded within NHS research. And I'll hand over to Dominic.
Thanks, Yvonne. Yeah, so yeah, we're now actively recruiting and receiving results, and then I'm going to just cover what the results process is. I can see there's been a question about that already in the chat, and then what the review evaluation and whether or not this is something that is then implemented into the NHS. Next slide, please. So the sites, because as they want to recruit 100,000, there's a lot of sites, and you can see in the blue dots in here across the country where sites are actively recruiting, and green is where they are onboarding, and there's a few more that they want to onboard before the end of the year. And this is to try and get diverse recruitment across the country, as Yvonne said in one of her slides. Next slide, please. And just so sorry, but if you want to sort of look at where the hospitals are, you can just check out the Genomics England website, and they will have a list of all the hospitals that are recruiting. So for the results for the generation study, there are three potential possibilities, and how they were fed back, as Yvonne mentioned, was really influenced by public engagement and with multiple different stakeholders groups. So that really fed into the study design and how patients receive results. So the three options are either a no condition suspected result, and 99%, so the vast majority, are expected to have no condition suspected, and that will be received by an email or a letter. This is potentially a few months afterwards, but I think at the moment it's around 19 days. And this will be from Genomics England to the parents and to the baby's GP. And that it will just say that they didn't identify anything, and what to expect about staying on the study as a future study participant, and they may be contacted again in the future about other research. And it's important to remember that this is not a clean bill of health. This just means that the baby is not suspected to have any of the conditions that the generation study search looks for. The other option is a sample failure. So there are rare circumstances where, for whatever reason, the sample was not able to be processed, and so they weren't able to generate a result. And that would again be received by email or letter from Genomics England to the parents. And if samples are not taken, the test could not be completed, and so they are no longer part of the generation study. And there's not an option actually to take another sample. And then the third, And then the third option is a condition suspected result. So this is predicted to be about 1% of the babies that are sequenced out of the 100,000. So about 1,000 across the study will have a condition suspected result. And this will be communicated by the phone by a specialist for that condition. And that will hopefully be a few weeks after birth. At the moment, it's around 21 days on average, and they're looking to try and get that down to a couple of weeks. As I said, it would be an NHS specialist, and that will be then to arrange an appointment with the family and the baby to have a confirmatory test. Because at this point, this is not a diagnosis. It's important to remember this is screening, so it's not a diagnosis. And it is expected that the majority of these are not additional patients. We're hopefully not going to have loads of false positives, but we're hopefully just finding these babies much faster and getting them seen by specialists faster and starting them on the best course of treatment, and hopefully having improved outcomes because of that. Next slide, please. So the people involved in the results processes, so that we have a case manager at Genomics England who receives results from the lab, prepares those packs and sends them on to us, the regional results coordinator. So each genomic medicine service, there are 7 across England, will have their own regional results coordinators, and they will then have maintain a list of specialists for each condition, and will support the transition of this research study into the NHS. So families are seen and can receive the care that they need and confirmatory testing. So we liaise directly with those specialist clinical teams. And who've been identified, and they will then, as I say, communicate with the family and provide the care they need. There also may be other healthcare professionals involved, so primary care is a big example, but they might be involved in supporting the results process even before or after when families are waiting for results, and address any challenges that there may be in communicating results or follow-up care. And we also, signpost families to patient organisations who are experts in supporting families, with some of these very rare conditions. And we have worked closely with people like the Genetic Alliance UK. Next slide. So just to summarise, so the result will be delivered by an NHS specialist for that condition. The regional result coordinator is available to provide support for this process. The condition suspected result is not a diagnosis, so confirmatory testing will be needed, and no condition suspected, no condition suspected result is not a clean bill of health. Babies should still be treated, the same as any other baby. Next slide. Just to sort of, go a bit more detail into some of the implications that there may be to other healthcare professionals' practice, and this will be very role dependent and on a case-by-case basis. But we, really see that if you do come across families who are part of the study, they may need some support communicating and understanding what results mean for them, support access and liaising with specialist teams or services with any concerns. Supporting parents while they may be waiting for a screening result or after receiving a screening result or diagnosis, and supporting signposting to patient organisations. And we're, as regional results coordinators, are able, we're very available to support with any questions that you may have. And we can provide our contact details at the end. Next slide. So, really what the study is trying to do is address a health inequality that people with rare disease often face, and often referred to the diagnostic odyssey. Can take a very long time to get a diagnosis, going from multiple different specialties, undergoing many different types of testing before they actually maybe are offered a genetic test, which is then able to provide a diagnosis and get them on the correct treatment and management. And so what this study is trying to do is completely skip out these middle steps of baby developing symptoms, baby referred to a specialist, and baby undergoing testing, and skip straight to a diagnosis. If you go to the next slide. Go straight to a diagnosis, potentially sometimes before the baby has developed any symptoms. And hopefully by doing that, the conditions they have selected, there is good evidence that there will be improved outcomes for them by getting a diagnosis and access to treatment faster and earlier. Next slide. So by the end of the study, hopefully we'll have sequenced the genomes of up to 100,000 newborns in England, and provided the evidence based on what the screening of those babies means for the future treatment and research with newborns, and the data needed to evaluate the research outcomes and inform future policy. Next slide, please. And so that evaluation is it's very comprehensive. So it's looking at the feasibility and acceptability of the use of WGS as a screening tool. Is that actually feasible and possible? The actual results and uptake, is this useful? Is there clinical utility in using whole genome sequencing and having access potentially to a genome across the child's lifetime? The health economics of this, like, is it cost effective, or is this a complete waste of money, or is it a really actually useful use of the NHS's funds. And the positive and negative impacts on this, is this something that we should be doing, as well as collecting the experiences and attitudes of stakeholders on their experience. Next slide. As promised, here are the contact lists for the regional results coordinators across England. So there's different regions depending where you are based. Those are their contact details. So if this does come across your practice and you need some support, we are available. Next slide. I think that's my last slide.
Thank you, Dominic. We're now going to Kate. Thanks, Kate.
Sorry, diving in. So just to bring this all together, we're just going to just do a look at a short case study, which is Owen's story. It just really brings to life what Dominic was saying was there about the value and importance of cutting out those potentially years of testing and hospital visits to get a diagnosis quicker. So next slide, please. So when Owen was born, he wasn't displaying any symptoms. He thought to be sort of a healthy and developing baby. And it was around about the age of 1 that his parents were noticing that he wasn't meeting his gross motor milestones. So he wasn't crawling, he wasn't sitting, and he certainly wasn't walking. So they felt like something was wrong. They reported to feel dismissed by doctors, overwhelmingly reassured, but they still felt that something wasn't right. So Owen underwent through multiple tests and hospital investigations, but unfortunately no diagnosis or cause was found as a result of those investigations. And then eventually his whole entire genome was sequenced, and this actually led to his diagnosis of
in the UK.
THI-related congenital hypothyroidism. And this is one of the conditions that is screened for within the Generation study. So he actually got this diagnosis when he was 4.5 years old. So this whole process was a good 3.5 years of trying to understand what was, stopping his gross motor skill development and what was going on for him. And at the time of diagnosis, he was only the 6th person in the UK and the 30th person in the world with this condition. And as Dominic and Yvonne were saying earlier, obviously the overwhelming majority of the results come back as non-suspected, but for those that do come back with a condition suspected, whilst they are rare conditions, they really have a huge impact on not only that person and that child's life, but also their parents. And Owen's mother was quoted and described the diagnosis as life-changing. And as a result, Owen was given the support and medication that he needed, and they described this as revolutionizing his life. So it really had a really significant impact on this child's life. And in the end, he actually went to mainstream school. He got the increased support that he needed, but obviously that took a good 3.5 years to happen. And the aim for the Generation study is to eliminate all that time and try and get that help and support early on, as Dominic said, even before he was potentially showing any symptoms or any hindrance in his gross motor skill development. So back to you, Karen.
Thank you, Kate. I think it's just a really good example of where the Generation study could make a difference in the future. We just wanted to signpost you to some further resources where you can find out more information about the Generation study. So the first website there is the Genomics England website, and Genomics England, of course, are leading this study. So they have quite a lot of information on their website. And if you want to know more information about how the conditions were chosen, and also if you want to see a list of the conditions that we're currently screening for, then head along to the Genomics England website. We've also also got a patient-facing website, generationstudy.co.uk, and this is where parents and the public can find out more about the study. There's a video on there that it gives them an introduction to the study, and there are resources in lots of different languages. There's also a portal where parents can register their interest if they are booked at one of the hospitals that's participating. And if you're interested to see if your local hospital is participating, you can go and have a look on there and see if your hospital is involved or not. Two other resources just to mention, we have Genotes. So Genotes stands for Genomic Notes, and these provide us with concise, accurate information about all aspects of genomics. They're regularly, can everyone just go on mute, please? So they're regularly updated and so very current. There are several Genotes that are specifically about the generation study, looking at different parts of the pathway, including the recruiting, the consent process, sample. Can everyone just go on mute, please? Thank you. Genotes specifically about the generation study, also about data storage and the results process. And also there are Genotes on lots of different conditions, including many of the conditions that we're screening for on the generation study. And then there's also the Clinical Pathway Initiative. And the Clinical Pathway Initiative, or CPI for short, is about mapping clinical pathways to the required competencies to deliver that pathway, and it links it to all the associated education and training for each step on that pathway. So again, if you're interested in sort of a more educationalist side and want to know more of the resources to help support all the different aspects of the study, then do go and have a look at that. So we now come on to see if there's any questions. I'll just highlight that we do have a feedback form. So there's a QR code there that if you've got a smartphone and just click on that, then hopefully it'll take you to the feedback if you could do that at some point. But we'll just see if we've got any questions. Now, Dominic, I can't see the chat, so I'm not sure if you can see the chat there and could just read out any questions that we've got at the moment.
So yes, we've got a few questions in the chat. Can we share the slides? I think we usually share the slides, is that right?
Yeah.
We'll go out to everyone that's come. A question about the actual case study, Kate, which I'm not sure if you're able to answer. How come that his newborn blood spot test did not discover hypothyroidism? Was it a rare type of the condition? I think the answer is yes, it was a rare type. So.
Yeah, thank you. That's really helpful question. Yeah, essentially it's not covered by the newborn blood spot screening. It's a sort of a rare type of congenital hypothyroidism that's genetic, and it's not picked up by the newborn blood spot screening. It's a different type. Thank you.
And another question from Laura. When are families presented with the study information? So they're consented during pregnancy by the research midwives. And what happens to those who suffer a loss? Do they come off the study, or does the consent remain for the subsequent pregnancy or birth? So is this sort of is this a death like during pregnancy or like after pregnancy? What?
I think they mean if there's a pregnancy loss in
following birth.
No, before birth. I think. Well, I don't know. Do you want to ask your question, Laura? Maybe that would be easier, so we can clarify.
Sorry, I don't know if you can hear me. Yeah, during pregnancy.
Okay, so if they do have a subsequent pregnancy, the consent process would need to be redone. As long as there wasn't a sample collected that's registered under that parent, they can participate in a future pregnancy, but it would need to be a separate consent because it's a different pregnancy.
Okay, thank you.
That's fine.
Is trust recruitment to the generation study ongoing? As there is no coverage in Wessex, could this be an inequality?
Can I just answer that? We actually, since the slide was written, we are now live in Wessex at Southampton, and we're working with another trust as well. So there are a few more sites that are going to come live by the end of the year, but by the end of the year, all the sites that are going to be set up will be set up.
Could there be a situation where a child is brought in the clinic in future who may have undergone the WGS test and the non-primary clinician desires to find out the result related to symptomatology? So you're saying could that genome be used by a clinician in the future? At the moment, no. It enters the National Genomic Research Library, and so it can be accessed by approved researchers. But it wouldn't be used in that context, and they'd need to have an NHS test done. That's my understanding, isn't it? Is that?
That's correct.
Yeah. What proportion of parents have consented to participate? Well, it's difficult. It's different depending where at the different trusts, but
I think nationally, as of the 30th of September, it was maybe 22.5 thousand, if I remember correctly.
You're correct on that, Yvonne. Yeah. And in terms of like recruitment at different sites, it's different patterns at different sites according to the different maternity populations that we've got. So, for example, at one of our sites, we find that about 2/3 of people are choosing not to take part when they start the conversation, but it's very variable across the country. So it's very different in different sites as to who wants to sign up for it.
I've got one more question. How long will the study run for? If children are going to be reconsented at 16, does that imply that the study is continuing for that long, or will this just relate to what happens with the data after the study concludes? So the study will be recruiting until March 2027, and then the genomic data, as I said, goes into the National Genomic Research Library and can be used for research by approved researchers. The reconsenting at 16 is just at 16 that child then has the autonomy to say whether or not they want to remain in the research library. And so if they don't receive their consent from that child, then they will be removed automatically. I hope does that answer your question, Jay? Great.
Yeah. I think there's another question from Gabriella, Dominic. If I understand correctly, this study performs whole genome sequencing and you report on 200+ genes. If so, will you look at other genes later? I guess you kind of covered that as well in your previous answer.
Yes, yeah. Unless you want any more clarity, Gabriella. No, Ellen, it doesn't report variants of unknown significance. It'll only report variants that have pathogenic or likely pathogenic evidence for them.
I think there's another question about insurance from Janet. It says, if a condition is found that may not manifest, would a family have to disclose for insurance purposes in life?
We're only reporting early childhood onset conditions, so we're not looking for later onset conditions in this study. So there wouldn't I don't think there'd be anything that you would need to report. Is that fair, would you say?
Yeah. And the variants that are shown to be highly penetrant, so very likely to present in childhood.
Should I just add in there as well is that only approved people have access to the data, so no insurance, marketing, or any kind of third parties would have access to that data that's held in the library.
Yeah. Are there any other questions in the chat?
Just thinking about Lynch gene and PCKD.
Yeah, Lynch
They're
not reported. No.
I don't know what PCKD is. Do you know?
Is it polycystic kidney disease?
Okay.
Yeah.
What are the main reasons behind why parents decline testing so far? Are there any trends, e.g. geography, different ethnic backgrounds?
I mean, I think it's early days, isn't it? We're collecting data on that where we can, and we can't always ask people why they're declining because, of course, it's their right not to take part in the study. But I think towards the end of the study, we'll have better information than that. I mean, some areas the uptake is very high and other areas there are more challenges, but I think there are a variety of reasons, and I think we will have more information later about that. I don't know if you've got any more from your sites.
Yeah, I think it's variable. I think one of the most common themes I guess we picked up is some hesitancy about the data being stored and security of data. Will twins become eligible for the study in the future? I don't know. I think, yeah, I don't know if it's something that they're looking to fix, and whether they will become eligible is the answer. Will they test whole genome sequencing trio?
So
It's moving.
Yeah, for some conditions they'll do a trio. If there's a suspected condition, a trio might be required by the NHS to confirm the diagnosis.
Or would you be considered? Okay. So is the recruitment offered at booking or after 20 weeks are normally done? It's not really offered at booking, but information about the study can be given. The research team would usually screen to see who is eligible, that they then either send a message directly or contact them to offer the study, and different teams work slightly different. I don't think anybody's offering at booking, but they do give information so that when someone talks to them later on about the study, at least they're aware or they've had time to consider it.
Have we got any more questions, or should we? We're nearly at the end of our time, aren't we? So
Yeah,
I think what I'll do is lovely. So I just thank you everyone for coming today and bearing with our IT issues at the beginning. We just wanted to tell you about the next webinar in our series, and that's on cardiac genomics. So there is a QR code there to sign up to it, and I think that will be absolutely fascinating. So do come and join us for that webinar, and yeah, I think that's everything for today. We will send out the link to the recording, obviously, as soon as it's ready, and the slides will be available for those who want them. So I'll put those in a PDF and make sure they're available. Otherwise, thank you everyone for attending today.
Thank you.
Thank you.